Welcome into this latest edition of the Charleston County Connects Podcast. We are joined once again. This is the first time. This is your second trip.
Second.
You are our first two-time guest.
Excellent.
Yeah. Chief Safety Officer of Charleston County EMS, Nathaniel Bialek. And we are here to talk about a new initiative within Charleston County EMS. It's the first of its kind in the state. It's been brought on by the opioid epidemic that is countrywide. And kind of explain how this came about and what exactly you guys are doing.
So, yes, it was brought on by the opioid epidemic over the last, so from 2019 to 2021, nationwide, we've seen a huge uptick in overdose deaths in the country. Right, we went from about 70,000 to about 106 in 2021, which prompted us to look at our practices and how could we kind of help interject into the harm risk reduction realm. So we started to navigate through DHEC and through the state, and we wound up becoming the first EMS agency in the state to become a community distributor of Narcan. So we've married our community distributor status and being an EMS agency to be able to distribute Narcan at the scene of an emergency.
So that's, just so I understand this, and for the folks listening, the folks watching, so they call 911 because somebody is in an overdose situation.
Correct.
EMS, fire, police, EMS are going to be first on the scene.
Correct.
How are you treating that patient then?
So we're gonna treat them as appropriate. If it's an opioid overdose, and if they're a victim of an opioid overdose, we're going to give them Narcan. We will stabilize them at the scene and then transport them to the hospital. After stabilizing, we will actually take a kit very similar to this, and we will do a very brief training with friends and family that are at the scene. And we will show them the kit, and the kit is made up of, so the bag, and the bag is important because not only does it tell you where to get more Narcan, but it also tells you on the back of the bag exactly the steps to provide the Narcan, right? So not only do we give the training, but we also give reinforcement. We also give some literature stuff. So inside the bag is 2 doses of Narcan, gloves, and some literature that goes along with it. Now, our program and a lot of programs focus on patients, and our program does focus on the patient, but our program is very different than a lot of other programs in the country in that we also focus on the families, right? The families who have to live with opioid use disorder every single day. So our literature is both in English and in Spanish. So it has a QR code, so it can be scanned for all of the assets that are in the area, right? All of our partners. And on the back, for those who don't have the ability to scan, we also have the phone numbers and the different helplines that they can call. Again, we also have that in English, and we also have it in Spanish.
The on-site training.
Yes.
So when did you guys start doing this?
August 1st.
August 1st.
August 1st.
So I don't know if you've necessarily had that interaction yet at the time of this taping, but when you're dealing with a family who has a loved one going through substance abuse and being treated on the scene, what are the challenges for EMS to try to work with them, I guess even emotionally, just to make sure they absorb this information? So
we do, and again, the training is fairly brief. It's about a minute and a half.
Okay.
And it explains to them when they see their loved one, when they see their friend, their family, or their loved one in this situation, when their pupils have gotten very, very small, when they're not breathing, when their skin or lips or fingernails may have turned blue, to give this medication. And these packets are very interesting because they're molded in such a way that this can be used as a trainer.
Okay.
So you can actually show them and put your fingers there, and this goes into the nostril, and again, it's on the back of this bag, but they're shown that. It's placed in the nose and it's administered. So we help support them, and unfortunately, there's not a lot of resources out there for families, and that's why we put them all in one place where families can really kind of work towards helping themselves, right?
Right.
So we're trying to help them and give them support.
So first of its kind, being able to treat a patient on scene as well as provide resources to the families of that loved one. In addition to that, it's been a multi-layered approach to dealing with the opioid epidemic. What else does Charleston County EMS do? Spot trainings, Narcan distribution?
So we are with the Office of, or the Directorate of Public Safety. We are doing this. This is one of our other harm reduction. So we do CPR, we do Stop the Bleed, and now we're also providing Narcan training at any one of our outreach programs. And we have a lot of outreach programs throughout the county.
Okay. And one important point to note, some of the information that's provided in the bag also can direct people over to the Charleston Center, DEODIS,
Yes.
which handles substance abuse treatment,
Yep.
training, and education.
Yep, they are absolutely one of our partners, and they're listed on our flyer, so
Okay.
they can make that direct connection.
Okay. Any other information for the public on this matter? Contact information should they need another supply of Narcan?
So if they need another supply of Narcan, they can call, and they've gotten it from us. They can call the front of the bag, which is 843-202-6700, and we will absolutely be able to get them more Narcan.
Okay. All right. Thank you very much for your time.
Absolutely. Thank you.
Thank you.